Welcome to Bunny Hugs and Mental Health, the podcast that deals with all things mental health. We talk to professionals, survivors, and loved ones about their sometimes informative, sometimes uplifting, and sometimes tragic stories. I'm your host of the show, Todd Rennebaum, advocate, recovering addict, experienced sufferer of depression and anxiety, and author of the children's book, Sometimes Daddy Cries. Hello and welcome to another episode of Bunny Hugs and Mental Health. I really appreciate you listening again. I'm learning as I go, slowly but surely, all the technical stuff, how to interview people, so on and so forth, so I appreciate you growing with me. Tonight I'm actually recording in my garage in my car. It's pretty interesting having a laptop, an interface, a microphone, some notes, some cords, all inside my car and trying to do this. It's kind of tough sometimes to have a podcast and try to record while you have a family and a house and dogs and furnaces and people trying to sleep and people getting up to go to the bathroom and plumbing running and all that kind of fun stuff. So this is about the only quiet place I could think of. It's also about 11 o'clock at night. And I got in the car because of road noise on the outside. Anyway, like I said, I'm learning. And if I have to do it in my car, I have to do it in my car. Just want to give a quick thank you for the sponsor of this episode, Regina Plumbing and Heating. Call 306-585-2000 for all your plumbing, heating, and cooling needs. This episode, I talked to Chief of Police of the City of Regina, Evan Bray. Police chiefs could have a fan club. I think I would be the president of that fan club for Chief Evan Bray. He does a lot of great work with homelessness, addictions, and mental health. I talked to him a little bit about all that stuff, and we talked a little bit about the police service and PTSD. He's a very passionate man. He's a great speaker, and I think he's a great leader. So please enjoy this interview. Oh, again, I lost my side of the conversation, so I have to go back and record clips of introducing clips of Chief Bray speaking. Again, this is not going to be the format going forward. It's just me learning how to do this. Anywho, I promise you next episodes will be just a recorded conversation I'm having with people as opposed to, again, whatever this is. So please enjoy. Without further ado, Chief Evan Bray. The first thing I wanted to talk about with Chief Evan Bray was drugs in the city and the record-breaking numbers of overdoses in not just the province, but in Regina.
Yeah, I think with regard to the drug challenges that we're seeing, especially when it comes to overdoses, this has been a problem that has it's risen exponentially over the last year and a half for sure. Obviously, the drug problem has been serious in our community for some time. We saw a real escalation with meth and the problems that come with methamphetamine from about 2016 forward. But last year, really almost seamlessly timed with COVID, we saw the increase in fentanyl-related overdoses in our community and the health risk that it was posing. And so, when you're investigating or you're looking at this topic from a policing standpoint, I think meth and a lot of the crime that came along with that looked a lot different than it does now with fentanyl. Fentanyl is very much posing a health risk in our community. The number of people dying from overdoses are at an all-time high, and this tragic turn of events, I think, causes all of us that are involved in some capacity in the drug challenges in our community to sit up, take note, and realize this can't be a 10-year strategy because there is going to be continued overdoses and death in the meantime. And we have to find a way to make meaningful impact today and for our children in the future. And so that's why The work that we're doing on this is really coming from multiple streams. As a police agency and policing agencies in Canada, you'll always see work done on suppression. How can we do focused enforcement on the amount of drugs being brought into our community and trafficked in our community in terms of illicit drugs? But that's really only one small part of it. When you look at people that are suffering with an addiction, a pair of handcuffs are really not the solution to get them to where they need to go. And we need to find ways that we can work with provincial government and other community partners that focuses on long-term health and treatment and therapy for people that are suffering with an addiction or a substance use disorder. At the same time, there needs to be aggressive harm reduction implemented in a community that really allows to, the day-to-day saving of lives while longer-term strategies are being put in place.
Chief Bray then went on to describe the differences between crystal meth and fentanyl and what that looks like when it comes to policing and social differences.
Well, what we saw with meth, meth posed a different type of threat in our community. It was, at one point, it was very prevalent, so it was easy to get. It was very affordable. It was extremely and highly addictive. And the effects of meth lasted a long period of time. So we had people that were out evading police, that were high on meth, that were committing robberies, that were doing things to try and continue to fuel that addiction to a very highly addictive substance. And it brought people into a state of paranoia, and they were constantly hypervigilant, not sleeping for days on end, those types of things. Fentanyl has really, not to say that it doesn't have a link to crime, because people that are desperate and suffer from an addiction are sometimes resorted to turning to crime to fuel and feed that addiction. But I think what we're seeing more and more of, though, is people are actually dying or having serious health implications as a result of the drug. There's no quality control in the drug world. These substances are multiple compounds, often put together in pill form or in powder form, and people are ingesting them in a way that they don't know what they're taking, and they don't know what combinations could be lethal. And so people are suffering in our community, and so that's why there's so much work from a harm reduction standpoint, even encouraging people that suffer with an addiction to not do drugs by themselves, have someone almost there as a babysitter to ensure that they aren't going to put themselves at risk by overdosing with no one there to offer any sort of medical assistance.
I asked Chief Bray about safe consumption sites and urgent needs sites. There is a difference between them, and he talks about both.
Yeah, so I've been involved in a few of these discussions over the last few months. So I'm aware of a couple of applications within our community here in Regina for, really what is a provincial exemption to the CDSA, Controlled Drugs and Substance Act, to allow for an urgent needs health facility. Essentially, it's like a safe consumption site, but it's given the urgent needs ability to open swiftly, while some longer term strategy is put in place for something a little more long term, like a safe consumption site. But really, the premise is the same. The premise is that it's a place in the community where people who suffer with an addiction can consume drugs in a controlled environment with resources and medical professionals on hand to minimize the risk to them, while they hopefully are able to get some support and maybe eventually help and treatment that would help them avoid overdoses, or maybe even find a way to work through the addiction itself. And I think with the urgent needs sites that they're looking at standing up here, it's more of a quick, urgent site that would be set up, granted by the authorities, granted by the provincial government, as opposed to a long-term site like what is in Saskatoon and in other communities, which is granted by the federal government. Health Canada has the authority to grant that exemption federally, but it's not something that would be just open for 6 months. This is more of a long-term site, and that is something that I think one, if not both of our locations that are applying for this are hoping that maybe they would become that long-term site, but in the meantime are hoping for a quick exemption so that they can get set up and essentially save lives sooner rather than later.
Chief Bray then talks a little bit about some overdose numbers. We recorded this on March 1st, so some of these numbers are obviously regarding the weekend before March 1st.
Just this weekend, we had a very high number. I believe there were 23 known overdose events in the city of Regina. 3 of them believed to be, we had 3 fatalities that we're linking, we believe, to that. And we ultimately will know when the coroners release their information. But those are high numbers in a city our size, and those are only the ones that are reported to emergency services. So the reality is there's likely a fairly high number that are going unreported as well. This is your podcast, yet I would like to ask you a question while we're on this topic, and if that's all right. And one, the one thing I talk about often is we're doing a lot of work with the Saskatchewan government, with the Ministry of Health, the Saskatchewan Health Authority, to ensure that we can enhance the level of inpatient and outpatient services, access to treatment, access to therapy, if therapy is the right course to go. And one of the things that we often hear, and I've said this before in interviews, is the person needing help has to want the help. Do you have any thoughts, and this will inform conversations that I have going forward on this topic, but do you have any thoughts on are there systems in place that are barriers to people wanting to access that, or are there things that we can do that enhance people's readiness to get help and to kick an addiction?
Chief Bray asked me this because he knows that I work in a treatment center, and I explained to him that the treatment center I'm working in is actually trying to expand not just beds in treatment, but actually opening a pre-treatment center and a post-treatment center, so that people with addictions could go to detox, and then instead of going home and being on a waiting list waiting to get into treatment, they actually go to a pre-treatment. And that's when a lot of relapses happen, a lot of overdoses happen, is after detox. So it would be, safe for people to go from detox straight into pre-treatment, where they wait and, there's programming stuff, waiting to get into treatment. Then from treatment, they could go to pre-treatment, which is, a little less intensive as treatment, but you would still have somewhere safe to be. They'd help you out with housing and looking for work and stuff like that.
Yeah, I think you hit on a good point. Because I often have talked about that continuum of care. And the second, if it's literally taking someone by the hand or putting your arm around their shoulder and showing them support, and then the second you take your hand off their shoulder, someone else is there and ready to help them. But the second the hand around the shoulder becomes a card with a date in 3 weeks to call and make an appointment, that's when things start falling off the rails. That continuum of care is broken, and a lot of time the people that we're talking about are very vulnerable, and they're often, they've got a sickness, they've got an illness, and they need that continual care. And we see that time and time again where, I've heard stories where an arrest by the police is the catalyst that gets you to walk in the direction to get the help you need. However, if there's a break in that care, or if, yes, we're going to get you into a bed, but it's 6 weeks from now, the chance for further problems in those 6 weeks is fairly high.
Chief Bray is part of a group of police chiefs from all across Canada that's really advocating towards legalizing all drugs, or at least decriminalizing small possession of all drugs. He kind of explains that, and I think it's a great idea.
Well, I think it really comes down to a couple of basic principles that you and I have talked about, and that is drug addiction is a health issue. It's not a crime issue. Addiction is a health issue, and handcuffs are not the solution in many cases to the problem. Now, I know there are times where it's that arrest that finally is the catalyst that gets a person in a position where they see, okay, I've got to make some changes in my life. But in many ways, the people that are struggling with addictions don't need handcuffs as much as they need some sort of treatment, therapy, supports from a health perspective. And so as police organizations and police chiefs across Canada, we see this very clearly because we deal with it each and every day. And so understanding, is there a way that we can continue to focus on enforcement efforts of large quantities for the purpose of trafficking, illegal importation, those types of things when it comes to drug enforcement. But on the day-to-day enforcement that potentially could happen where people possess a small amount of drug that clearly is for personal use, can we replace the ability to lay a criminal charge with a connection, and maybe in some cases a forced connection to health or social services or other types of treatment or supports that exist in the community? To me, it's not adequate to just simply say, okay, we're going to decriminalize simple possession. Because if you do that and there's no link, because the police are going to continue to encounter people. So we, arrest someone some night for a robbery that happens in our community. And while we're dealing with them, they're clearly high and they've got cocaine in their pocket. And it's not enough that they would be thinking that it would be used for trafficking or selling to someone else. It's simply, this is their habit that they're dealing with. If there's a way, instead of laying a possession charge, that we may have to lay the robbery charge. They may have committed a robbery and we may have to continue down that road. But is there a way that we can link them? It's almost like the drug treatment court principles, right? There's ways that we can divert away from criminal code and courts if they're willing to go through treatment, if they're willing to go into therapy or whatever the situation may be that is best suited to them. And that's what we need. We need that connection. It's not as simple as taking away one without having something there in a substitute, but it's about giving police the ability to link to healthcare as opposed to resorting to the justice system. We've seen other countries where they have, essentially deployed this sort of tactic to try and dig into this problem, and it has been successful. And it's ultimately, what are you trying to measure? Are you trying to measure how many times you can make an arrest, or are you trying to measure how many people we can get healthy? And that's really, I think, the focus.
I asked Chief Bray to talk a little bit about drug court in Regina. That's where people that are arrested for non-violent drug-related crimes, they go through drug court and they actually get treatment and help. And he discussed that.
We've got a few treatment courts in our city. One is drug-related, one from mental health perspective, one with domestic, kind of a domestic focus. And each and every one of those really looks at the individuals as a person, tries to understand what their needs are, and it's not kind of a one-size-fits-all. It really is about thorough rehabilitation and understanding. And I've sat down and had a bowl of soup with people that have, 1 year been responsible for 200 stolen autos in our city, and the next year having a bowl of soup with me talking about how they feel after having come through 1 year of drug treatment court. And it really is quite impressive. But back to my continuum of care, you can't expect that once drug treatment court is done, even if the person has got themselves healthy and clean, there still has to be some kind of ongoing support and connection to service there to help people along the path. It's no different than people, and many of us have people in our family that have gone through alcohol challenges. That's why there's weekly meetings for people in AA or just different support groups like that, because you can't say, I'm good and I'm going to carry on for the rest of my life with no support. It doesn't work that way.
Chief Bray then discussed other social issues that regard mental health and addictions. He talked about some numbers regarding suicide and domestic abuse.
We do regular reporting now through our Board of Police Commissioners. We used to do just crime stats. And so now, as part of our crime stat package, we're including a dashboard that really digs into some of these other more social issues. Things like domestic disputes. So, for example, in the month of January, our police service attended to 618 domestics, and that is on average 20 per day. So that's a significant number of domestic disputes. That's a large number, and each one of those is, let's not let's not forget it's a very complex problem. Each one of those, I mean, with the exception of the odd one that maybe is not founded and it wasn't a domestic dispute. It was a neighbor reported some loud yelling, but it was, something different. But for the most part, they are challenges that aren't going to be solved by police officers within 30 minutes of arriving. Could be an addiction challenge, could be some mental health challenges, could be children that are involved in gangs. It could be loss of employment, lack of education, lack of food security. Like there's a lot of social issues that often weave themselves into domestic conflict. But knowing that we're going to, on average, 20 of those a day, and knowing that a lot of them require follow-up work, links to community supports, that's a significant drain on just community-based organizations in our city in general. And if you look at something like suicides, missing persons, those are two very different categories, but on average, we're going to 4 of those a day in our community. And so those often speak to, complex problems, and people are trying to find ways to avoid dealing with them. Whether it's people running away from home or people that go missing, oftentimes it's not always youth, but many times it is, and they're trying to escape something that they don't know any other way to escape it. And very seldom or very often that's the same with suicides. People that are just tired of pain and suffering, whether it's physical or mental or combination, and they're trying to find ways out of this situation, and they really need help. So those types of calls, I think, really speak to the complexity and the volume of social challenges that we have in our community, and they are all interwoven together. There's really oftentimes very little separation between someone struggling with some sort of a mental illness and maybe an addiction problem or domestic conflict that arises in the home as a result of one or both of those factors.
I asked Chief Bray if some of the numbers in domestic abuse and suicide have gone up since COVID.
Yes. Yeah. So our domestics, I believe last year pre-COVID, we were on average at about 16 or 17 a day, which is still sadly an alarmingly high number. We have some of the highest domestic conflict rates in all of Canada in our province, and certainly in the city of Regina. So we know that those numbers were high to begin with, but we've seen an increase, and we've noted this increase because as we continue to monitor crime trends through COVID, we were seeing a decrease in property crime and some more easily measurable challenges in the community. How many cars are getting stolen, how many houses are broken into, those types of things. But yet our calls for service were not going down. So if crime was going down here, but calls for service were not, what's replacing the crime? And so when we dug into it, we're noticing that some of these social challenges are really in many ways on the incline.
I was curious if Chief Bray thought the high numbers in overdoses this last year was because of COVID, or if those numbers were just generally going to go up anyway.
Yeah, I think that's a tough question. I do think there's likely some connectivity. I think about COVID-19 and people that are not without a job, that have been able to continue to work, that have been able to continue to buy groceries, support their family, all of those things. I think we are all dealing with heightened anxiety and levels of stress. So people that are vulnerable, that don't have jobs, that are already struggling to put food on the table, maybe that had, add some complexity to it. They have an addiction that they're trying to deal with as well. I don't think COVID-19 makes it easier. I think it makes it tougher, and I think we're seeing it manifest in a variety of different ways in our community.
I praised Chief Bray for his language he uses when he talks about addictions. It's nice to hear someone in power, especially a police chief, use the word sick instead of the word criminal when talking about people with addictions.
No, I thank you for saying that, but it is so true. I mean, I think about just even over my career, if you're talking to someone who truly is suffering with an addiction, and yes, they may have committed a crime to find a way to get more drugs because of their addiction, inherently, most people that are suffering with addiction are not criminals. Like by nature, they're not criminals. They might be committing crime because they're in this high risk lifestyle, but they need to find ways to continue to deal with this addiction that they have. But if you can deal with the addiction, then likely the crime rate goes down proportionately because it's very solely the purpose that they're out there putting themselves in that high risk position.
I talked to Chief Bray about the amount of people in our jails that are in there because of drugs, and I know the numbers are crazy high. Not so much maybe for possession or trafficking or DUI or public drunkenness, but for assault, domestic disputes, even home invasions, robberies, car thefts, all to support their habit or because they were drunk or high.
We get called to, call it a robbery. A robbery occurs on the street, and we go and we attend, and yes, someone had a gun and put it in the face of a person working in a store and demanded money, or used a weapon on a street to take beer away from someone who just purchased it, or an iPhone in the ball cap from someone walking down the street. Whether it's a street robbery or whether it's a robbery that's happening in a business, it manifests in a way that police will attend. But when we try and strip back what's causing this person to commit a robbery, like not everybody's committing robberies, so there must be a reason why. Many times you can link it to drug use. But that to me isn't necessarily where root cause exploration stops, because there's a reason why people are using drugs, right? There's got to be a challenge. There's something that has happened that has caused them to reach out and to try drugs or to experiment. And I mean, I'm telling you something you would know much better than I do. And that's where we need the investment. We need to find a way to invest and help people that can solve many things for them, one of which might be this addiction, this coping mechanism they have. And as a result of that, you're going to lower crime rates. There's no question about it.
I then asked Police Chief Bray to discuss the PACT program that is working hand in hand with the Regina Police Service. PACT stands for Police and Crisis Team.
It's a section of our police service. The Police and Crisis Team is made up of police officers and mental health workers that work through the Saskatchewan Health Authority for the province, but are partnered up in a cooperative agreement with our police service and police services throughout the province as well, in a way to try and provide some meaningful intervention or assistance to people in our community that are struggling with mental illness. I think there's a variety of ways that we would perform some sort of an intake, and oftentimes it isn't that first contact that our PACT team is involved in. So if we get a call of, someone who's contemplating suicide, oftentimes it's going to be our frontline officers that will respond to that call. It's an emergent 911 call for service, and sometimes there's an element of risk involved, and so they will step into that situation and de-escalate, and obviously most times we're able to get there and prevent the person from harming themselves, and thus get them, again, continuum of care, get them to a hospital where they can be seen by a professional. That is where our police and crisis team will often step in and assume management of this situation. And so it may mean spending some time with them at the hospital while they're waiting to be seen by a professional. And those officers and those mental health professionals obviously have training and understand the discussions that should be happening and the available treatment that's out there, but also kind of longer term challenges and barriers that they are likely to encounter down the road. Many times we're seeing, especially amongst our vulnerable population, even the ability to make it to doctor's appointments, to keep a schedule so that they understand what day their doctor appointment is that they have to go to get a prescription renewed. Those types of things is where people can fall between the cracks. And so our crisis team will really be that liaison to work with people in our community who have this challenge, and organizations or arms of government that are there to help and assist people that are navigating this. And so referrals to other agencies, diverted from future emergency calls. Sometimes it's just to provide an ear, someone to listen to them on the phone. We had an example where we had a lady who was calling our police service communication center hundreds of times in a month. and our PACT team started doing work with her, getting her to regular appointments and have a regular scheduled phone call with her on a kind of an every other week basis, where they'll spend half an hour talking to her on the phone, and the number of calls to our communication center is now 0. And so that sort of intervention that they've been able to do really does save meaningful resources when it comes to delivering that emergency service to our community, but at the same time is providing a greater level of care to people that are struggling with mental illness.
I asked Chief Bray if the mental health workers with PACT actually go to the scene.
They can. There are some cases where, they work a 12-hour shift, and they work like it's not just a day shift. They work a night shift as well. And so there will be times that they will respond to a call, but oftentimes, even though there's a police officer there, if it's a call where someone's in a house and has a gun, we often won't be asking that mental health worker to be the first to enter that house. We're going to ask our police officers to go in, make sure the situation is safe, but having them there as a resource, someone to consult with, or someone to do an immediate handoff. If let's say the call that comes into our police service is someone who's in crisis themselves, who's called to our police service, say, I'm having these thoughts, I'm really down, I feel like I need to talk to someone. Obviously, those are calls where perhaps that police officer and mental health worker, that team, would be comfortable in going out. They've reached out. It's a lot less volatile situation and something that they could handle. So there will be times that they will take that initial call for service, and at other times they're there almost as the handoff for the continuum of care.
We then discussed the follow-up care that the PACT team does.
Yeah, they do a lot of, they basically open a case file. And so, in 2019, our number of case files was 1,783. And there was, everything from kind of a risk review to immediate action that might be done. And then a lot of times there's follow-up. And sometimes we just were talking with our council here a week ago about some of the follow-up care and examples, and there's times where our team will spend 60, 70 hours with one person, not all in a row, but if you tally up the time they spent from January till June, it might be 70 hours. And sometimes they'll have no contact for a month, and then they'll talk to the person and they say, well, I need to get down, I need to get my prescription refilled, but I've got to meet with the doctor and I have no way of getting there. I mean, they'll either ensure the ride happens, get a bus pass. In some cases, people are struggling because they don't have ID, so they've helped people go and get ID. All of those little barriers that exist right now, most people that have a job, don't suffer with an addiction, don't suffer with maybe mental illness of any sort, you don't think of those things, like, how would I even get to this appointment? Or, yes, of course I've got ID, but not everybody does. And those become big issues in people not getting into their appointments, not continuing to take medication that they need, and eventually it results in a crisis that police are going to be dispatched to. So that preventative or proactive work that we can do and that our PACT team does is very beneficial, and sometimes very hard to measure how much work they're actually saving the police service. But I think a better way to look at it is how much help they're actually providing a person, because if the person doesn't go into crisis, it's hard to say, well, they would have had they not had this care. But it is, I think, a very tangible thing, the work that they're doing and the help that they're giving individuals in our city.
We then discussed the connection between mental health and addictions.
There's definitely a connection, and you and I have talked a bit about that today. I think the province, even in standing up a new ministry that focuses on mental health and addictions, is a recognition that you can't operate in a single lane and expect that you're going to be able to solve the problem. It's actually, and I'm straying off topic a little bit, but it's like the firearm issue in our community. It's not just about going out and trying to find every firearm that's being used illegally and taking it off the streets, because it's the people that are using the firearms that can be the challenge. And why are they using them? Is it drug related? Is it gang related? So the issue of mental health and addictions are very closely tied. And so recognizing that and being able and willing to share resources, to collaborate, to work with other partners. You'll often hear police, and certainly I will talk in the public about, we can't solve this problem by ourselves, nor can social services. nor can Saskatchewan Health Authority. This is going to take a community effort, and we have to be willing to look at it from all angles. So I think it does come down to resources, because we know that when you're dealing with complex problems, it's the more complex the challenge, the more full-time resource that needs to be assigned to be able to make a meaningful difference. And so when you have caseloads, whether you're talking police officers, social workers, mental health workers, whatever, if you have caseloads that are prohibitive to regular contact with clients, that is going to be challenging. And I know just from talking with counterparts that work provincially or municipally, you can have a client list that allows you to talk to your clients once every 3 to 4 weeks. Well, that's not enough when you've got people that have acute needs that are dealing with real challenges. If we can look further downstream, get help and treatment, and in some cases therapy that's needed, maybe you can touch base every 3 weeks, but certainly not on the front end of some of these challenges. So, I do give the province a lot of credit. I can tell you that the Ministry of Health, Max Hendricks, who's the Deputy Minister of Health, has been leading an opioid task force that he started up really at the start of the pandemic, and I'm talking the COVID-19 pandemic, and to their credit, have not taken their foot off the gas pedal. We met right through that. They've got a very aggressive lens of things that they're trying to do, and a lot of it is understanding what services and supports are out there. That helps you identify where gaps might be and what's needed to try and dig into these challenges. So I think there has been some good work done, but we have to recognize that the longer it takes to stand up a new program or extra services or supports, people are dying in the meantime when we're talking about addictions. So that's why we need to work collaboratively with community groups who are often the boots on the ground, providing daily, regular counseling services, support in various different ways, because their involvement and ensuring that they're funded properly will definitely help bite into these problems too.
Saskatchewan has a new minister. He's the Minister of Mental Health and Addictions. He has some other duties, I think, rural health and seniors health. But it was nice to see that there is now a minister for dedicated to mental health and addictions. I asked Chief Bray if he had any discussions with him yet.
Yes, so I've had opportunities to speak with Minister Merriman in a few different ways, and a lot of the work that policing agencies are involved in are more at the Deputy Minister level. We've got our Deputy Minister of Corrections and Policing tied in with Deputy Minister Max Hendricks from Health and a few others to try and put some strategies together on how to deal with these challenges. And the fact that those deputy ministers have been given space, cleaned off their desk, willing to be part of these. It's not even assigning that a task force be put together, but chairing the task force. That's really positive. I think it's really positive. It shows a commitment at a very high level, and I've certainly been happy to be part of that for sure.
There's a strong connection between homelessness, addiction, and mental health. Well, really, mental health and addiction, it's the same thing. It's annoying that they're separated. But anyway, homelessness is obviously prevalent in Regina, and Chief Bray discussed about attending the homeless memorial ceremony earlier in February.
Yes. I was virtually there. I recorded because they did it on Facebook Live, so they weren't encouraging people to go down. But I've participated the last number of years, usually in person. This is the first year that they did it virtually. It really brings the community together and exposes you to an hour and a half of what some people experience day in and day out, and that is whether it's frigid cold or brutal heat in the summer, and not having a home or a safe haven or a place to go, and what that looks like. And it's always fitting that people are dancing on their toes trying to keep warm, and their ears are cold, and we're having speeches and people talking about the importance of this issue. It's not lost on me that that this is all part of the experience that many people in our community and others across Canada are challenged with every day. And we also know with our homeless population a couple of things. Number one, homelessness often means there's a lot of complex issues there. It's not just as simple as we need to find a home for someone, but finding a home first and then finding ways to address other challenges. People always kind of on that hierarchy of priority will always look to those real basic needs. We got to, eat, we got to sleep, we have to, all of those types of things. And unless you've got that taken care of, you can't focus on finding hope and joy in your life and dealing with addictions and all of these other issues. So that's part of homelessness, is understanding it's not a single challenge. It's often the gateway to a very complex array of challenges. And the other thing with homelessness is it's not just about people who for 20 years have not had a home. Sometimes it's about people that are in a domestic situation that they're forced to leave with their children but don't have anywhere to go to. Or someone who's couch surfed for 20 years and although they've always had a roof over their head, really don't have a home and don't have an address that they can call their own. And so there's many different types of homelessness that we deal with. It's not just someone who's sitting outside that you might see and that's your picture of what homelessness looks like. It can take on many different forms.
I couldn't speak to the chief of police about mental health and not ask him about PTSD and addiction within the police force.
Yeah, no, I really appreciate the fact that you're bringing this up, because this is a very important topic for me and for all police services to have an understanding of. Police officers are women and men in our community just like everybody else, and they are subject to the same effects of pressure and stress and anxiety and all of those types of things. And so we definitely see police officers within our police service and within the province that sometimes might be diagnosed with some sort of occupational stress injury, whether it's PTSD or something else. And in other cases, there may not be a diagnosis, but we are seeing, could be abuse of alcohol. It could be some sort of an addiction or a way of trying to cope with the constant pressures and stresses that they see in their day-to-day work. And that's even compounded if they've got pressures, stresses, and anxiety-related complexity that's happening in their personal life. So someone who might be going through a separation or having problems with children or those types of things. So it's a very real issue for us. It's something that, we have officers that have struggled with it and gotten healthy. We have other officers right now that are in the middle of their struggle. And so finding ways that we can help them, early intervention or identification of the challenges that they might be facing and ways that we can help, that's a big part of it. So we have training for our officers in Road to Mental Readiness, which helps you understand within your peer group where someone might be displaying symptoms where, they could be struggling, and ways that you can approach them, start conversations, get them connected with supports and services, those types of things. Sometimes it could be a supervisor who's seeing deficiencies in work performance where there normally wouldn't be, attendance problems, those types of things. And so it can manifest itself in a variety of different ways. Sometimes we'll start having public complaints about an officer, people saying I wasn't treated very nice, this person was swearing at me, they didn't deliver very good service. And you can sometimes start to see a bit of a pattern, and it allows us to interject in a way that we can help that officer get back on track without having to resort to discipline, because oftentimes it is really about trying to help them through what their challenge is, as opposed to them just willfully wanting to step outside of policy or direction and those types of things. So it's definitely something that is, I think it's becoming a more talked about topic. The stigma is being reduced, just like mental health in general. People are more apt and willing to talk about it now. But in the policing profession, if you think about the work that we do, there's a lot of bravado. There's a lot of, we ask police officers or people that work within police agencies to step into our community and handle problems. Essentially, we're asking people, are you good at handling problems? And if you are, and you go through all these tests, then perhaps you're going to get hired by a police service and be required to be a problem solver in the community. And so many times these problem solvers don't want to put their hand up and admit they have a problem they can't solve. And so we have to find ways to knock those walls down and get them to feel comfortable and vulnerable enough that they're confident that they are not going to be stigmatized. They're going to be helped, and they're going to be supported by their organization.
I asked Police Chief Evan Bray if there was any on-site professional help for his officers and what other kind of supports they may have.
Yes. Yeah, there is. In fact, we just last year hired a psychologist on staff. One of the challenges we were having, much like we talked about earlier, is the access to help. And so that's, if we've got someone who's struggling and we need to find a way to get them in front of a professional that can help diagnose what their challenge might be and ultimately recommend some treatment plans or ways in which the person could receive help, waiting 3-4 weeks to get that initial triage consultation is not beneficial to anybody. So now having someone on staff that works out of our human resource section that can provide that almost instant contact with the member and help navigate through the system to find what ways we can help them best has been very beneficial. But we're also doing a lot of proactive resiliency-based work, things that we can do to help one another to identify when, maybe you're not redlining yet, but you're getting close. And how can we recognize that in ourselves and in our peers? And how can we offer them help in a way that may prevent them from having to need time away from work and those types of things? So there is a lot of work. We have constant communication through email, through video communication in our regular training that we do every year. There's lots of ways that we try and get to members wherever they're at within the organization and provide them that help, or at least help them understand where the connections are should they need it.
I mentioned to him that I didn't think the war on drugs was really working.
Well, it certainly is not, but if you have thousands of people in a community that are suffering with an addiction, there is a war we can mount on people that are bringing illicit, harmful substances, essentially poison, into our community and selling it. But you can't do that without a program or a system in place set up to try and help those that are suffering with an addiction. If you do one without the other, it's not going to be successful. It's the three-legged stool analogy. And to me, in order to stop the stool from falling over, you've got to make sure that each leg is doing its work and is fully funded and resourced in a way that it can make a difference.
I then asked Police Chief Bray if he had anything he wanted to add before we finished our conversation.
This has been the most thorough conversation I've had with anybody on these topics. So no, I think it's good. I appreciate it. It's, I have lots of passion for this stuff because we see it every day. And I think we, the police, need to be leaders in these discussions because of the fact we see it, but we also have to be, kind of recommendation focused. What can we do about it? And are we willing to participate in things that might ultimately change behavior or reduce crime rates or reduce victimization in our community? And so it's important that we're part of these discussions for sure.
What a great guy, what a great conversation. He has, I think, a pretty big heart and a lot of empathy, and that's the kind of the person I want in charge of my police. I live in a small town, so he's not the chief of my police, but we got some good RCMP officers here in town, so I'm not complaining. Anyway, I just want to say thank you so much again for taking the time to talk to me and for this great discussion. One last thing, Chief Bray sent me the audio from his side. We were talking over the phone, and I'm just going to play a little clip here. After our discussion, you can hear him hanging up the phone, and then he makes a little comment.
That's the wrong number.
I don't know if you heard that, but he hung up the phone and said that was the wrong number, and then someone else started snickering. Anyway, I thought that was really great. Next episode, I have another amazing guest. His name is Tristan DeRocher. If you don't remember that name, let me refresh your memory. He was in the news quite a bit last summer. He's the Young Indigenous Fellow that was protesting suicides in the Indigenous community. Not just the Indigenous community, but all over Saskatchewan. He walked from La Ronge, some 650 kilometers, all the way down to Regina, where he set up a teepee, set up a photo gallery of people who lost their lives, and he fasted for 44 days, each day representing a different MLA that voted down a suicide prevention bill. He is an amazing speaker. He has such an incredible story. I just love it. I think he's a folk hero. Anyway, listen to that episode, and you know what? I didn't lose my my track on that one. So it is actually him and I just having a conversation. So yeah, listen to that next episode. Thank you for listening, and please subscribe, rate, and review however you are listening to this podcast. It only takes a moment, and it really helps the show out with getting noticed. This episode has been sponsored by Regina Plumbing and Heating. Call 306-585-2000 for all your plumbing, heating, and cooling needs. If you are having a mental health crisis, please call the Canadian crisis number at 1-833-456-4566. In Saskatchewan, the mobile crisis team in Prince Albert is 306-764-1011. In Regina, it's 306-525-5333, and in Saskatoon, it's 306-933-6200. Don't forget to check out my children's book, Sometimes Daddy Cries. Sometimes Daddy Cries is told through the eyes of a boy whose father suffers from depression. He sees his dad get sad, rest, and even go to the hospital, all while comparing his father's depression to a physical ailment. Available on Amazon.ca. I'll see you next time. This is Todd Redebaum saying, make your beds and take your meds. Bye.